Bismillahirrahmanirrahim. I am Muhammad Sadil Islam Sharkar, again from University of Chittagong, Bangladesh. Today I want to discuss on some misinformation, some rumors, some gossip that are making we people very anxious, very panic, and creating some odd situations in the surrounding area or in our society. Uh, According to WHO, it was defined misinformation as an infodemic of misinformation and rumors is spreading very quickly, so quickly than the current outbreak of the coronavirus. That means infodemic of misinformation. Infodemic means uh, an excessive amount of information regarding a problem, concerning a problem, uh, such that the solution is made more difficult of that problem. That means excessive amount of information regarding a problem that will ultimately create a solution very difficult to make a solution of that problem very difficult. So this misinformation and these rumors are very dangerous, and this will make a stigmatized condition in the surrounding society. So we need to follow some do's and don'ts uh, to remove this misinformation, to remove this sorry, to eliminate these rumors from our society regarding COVID-19. So we should speak accurately about the risk of COVID-19, and we should speak in point of fact uh, about the hazard of COVID-19, and we should exactly explain, we should explain exactly, and we should explain honestly about the danger of COVID-19. So speak based on some scientific data, and speak based on official health advice, especially say depending on recent or latest official health advice. And we should not say, we should not speak, we should not spread, uh, and we should not repeat unconfirmed rumors, and we should not utter undefended rumors, and we should not say unsupported misinformation, and we should not spread disapproved misinformation or disapproved rumors or disapproved panic situations to the surroundings. And we should be very careful about our language, that we should not use any exaggerated language, we should not use any profuse language regarding COVID-19, regarding this novel coronavirus, and we should not use any hyperbolic language that will make a man confused to understand the exact meaning, exact features of COVID-19. And we people should talk positively, very positively, and we should think positively, and we should talk surely and depending on certain documents uh, based on research, based on study, and that I have said based on some scientific data. And we should think positively about COVID-19, and we should think surely, and we should think certainly about the features, about the pathways or about the mode of action of coronavirus within the human body. And we should give emphasis on the effectiveness of prevention, and we should give emphasis on the treatment measures when someone is suffering from COVID-19. We should give emphasis on the adopting we should give emphasis, we should give our lever, we should give our interest, and we should pay our interest in the on the effectiveness or on adopting protective measures, and give on protective systems, preventive systems, and give importance on the preventive measures of COVID-19 and to prevent acquiring the coronavirus. We have to give emphasis on the protective measures to prevent or to acquire or to control the new coronavirus. As well as we should or we need to do early screening, we need to have a early testing, and we need to have some steps for early isolation of the patients. And finally, we should ensure accurate, adequate treatment for the suffering people, those who are suffering from COVID-19. We should not emphasize on the negative messages. We should not dwell on the negative messages, please. We should not stay with the messages of threat regarding COVID-19, and we should not live, we should not inhabit on the masses of threat about COVID-19. We should be very careful, we should be very keen, and we should be very serious about this misinformation and about COVID-19. And one more thing that we should follow and that we should do some very important things. For example, talk about new corona disease. We need to talk about. We need to say about, and we need to explain this, and we need to utter this again and again about the new coronavirus disease within we people, within our family, within our society, and within our country. Then it will be easy to understand this COVID-19. It will be easy to understand about the new coronavirus. Talk about people who have COVID-19. Talk about people acquiring COVID-19, and talk about people who has been contracting COVID-19, and talk about people attaining COVID-19, and talk about people who has been obtaining COVID-19 already. So we need to talk, we need to discuss within we people very positively and very interesting way, that it will not be a dangerous one, it is not a epidemic one, it will okay fine, it's a pandemic, but we human being can withstand before this COVID-19, this novel coronavirus. Some we need to discuss about some thing that I have said, do's and don'ts. Which should we do and which should not we do? Which will we discuss and which will not? Which don't we discuss? That means the matters that should be discussed and the matters that should not be discussed, and the way how we discuss about this COVID-19. What should we discuss? What should we talk what should we speak, what should we say regarding COVID-19. Very serious and very important to be very cautious about this COVID-19 before spreading, before discussing, before talking, before speaking about this COVID-19 virus. New coronavirus that has defined as COVID-19. So we should not refer patients as COVID-19 cases, and we should not refer patients as COVID-19 victims. It's a very important thing. If we define a patient as a COVID-19 case or as a COVID-19 victims, it will have some negative impacts. It will imply some negative impacts to the society. And don't talk about people transmitting disease regarding COVID-19. Don't talk about people that he is transmitting COVID-19, or don't speak about people of infecting others. That means these COVID patients, these coronavirus affected patients will transmitting this COVID-19 or spreading these infections to others. We should not talk about it. We should not say like this, because this gossip, this speaking, this conversation will create some negative mentality within the suffering peoples. And we should talk about that means we shouldn't talk about people spreading the virus. We should not talk it. Okay, fine. We know this COVID-19. This coronavirus is transmitting or spreading from man to man, or man to women, or women to man, or women to women. That means human beings to human beings, not from animals to human beings, or human beings to animals. But we should not talk about this. Okay, fine. For awareness, we can say we know, but in front of a patient, in front of a COVID-19 patient, in front of a coronavirus patient, we should not talk it, because this will create some negative impact. This will create some intention. It will create some pretend within the patients that he will ultimately willing to spread this, to transmit this, and he will not control himself. That means we should not neglect a COVID-19 patient. We should not identify a COVID-19 patient as a transmitter, as a spreader who is going to be infected his surrounding peoples, because it will have a negative attitude. It will create some negative aptitude, within his mentality. So he will be desperate. That means we should not identify a patient as a COVID-19 transmitter, COVID-19 spreader, COVID-19 infecting others. As it implies, that I have said, that as it will implies intentional transmission by that people or by the patients, and it will expound that COVID-19 patient to be intentional for transmitting this disease, and he will not take care. He will not use tissue. He will not use any napkin, or he will not use any mask, and it will mean emotional transmission within the surrounding people by these COVID-19 patients, and it will connote intentional transmission, and ultimately this COVID-19 patient will think the surrounding people are blaming, surrounding people are assigning blame to that people, to that patients, and it will engage a COVID patient or COVID-19 patient to his emotional breakdown. It will create some emotional breakdown within the patients, and it will assign impeachment of that patient. So before talking about COVID-19, before speaking about this new coronavirus, we will be very careful, and we will be very careful about rumors. We will be very careful about misinformation. And very important thing that has uttered by Director General of WHO, Dr. Tedros, that okay, fine, you will get a lot of information, you will hear a lot of information, but that should be based on scientific data, that should be based on latest official health advice, and that should be based on legal documents. His excellency, he also said, no need to watch a lot of news. Okay, fine, 2 to 3 times from reliable news, from reliable media. Otherwise, it will make you desperate. It will make you panicked, and it will suffer from stigmatization. And stigma is a panic situation, panic condition within the people due to some misinformation and some misguided, undefended, and unsupported. I mean, which is not approved. That means disapproved misinformation. So it will be very dangerous. Uh, According to the voice of Director General of WHO, he has said that stigma is more dangerous. Stigma is more dangerous than the virus itself. That means he is trying to say, if we suffer from stigma, this is more dangerous. This is more detrimental, very harmful and hazardous than the coronavirus itself. So don't be stigmatized with some misinformation, with some rumors. We should be very careful before saying, before speaking, and before uttering regarding COVID-19. And WHO Director General also said, stigma is the most dangerous, enemy for the human being. So, due to this coronavirus, due to this COVID-19, we will be very aware. We will be very serious about misinformation, rumors, stigmatization, panic situations, and some false information. And then we should be very careful about some false images are coming through different channels, TV channels, media, by social media, especially social media. There are a lot of rumors. There are a lot of gossips. That someone is saying he has a way to remove or to delete COVID-19 from Bangladesh, even from the whole world. Just he is claiming to have some money. So how dare he say this? How dare he say? How did he say? What is his documents? What is his arms? What is his strength? How can he remove this or delete this COVID-19 from Bangladesh and even from the whole world? So it's a gossip, it's a misinformation. This will create some panic situations within the general people, that why didn't our government take or giving him some money to delete this COVID-19 from Bangladesh. So these will create some panic situations, and these will create some unstable situations within our society. So we should follow the guidelines. We should follow the guidelines of IDCR in Bangladesh. We should follow the prescription. We should follow the advice, latest advice regarding health by from our doctors, from our official personnels, those who are assigned to say, those who are assigned and saying in front of the media, those who are confronting people time to time, without base, without legal documents, without legal statement. Because one more thing, research study is not available regarding COVID-19 because it's a new coronavirus. So it will take time. It will take months to months or years to years to have a basic information, to have a reliable information about the treatment, about the vaccines, about the mode of action of COVID-19. So we will have to wait for a time. A course of time is required to know accurately and precisely. So other than we should not talk, we should not speak. If we speak, we should have minimum documents. We should have some legal documents, and we should know the real information, because a lot of information is available on the website of WHO, on the website of IEDCR. So be cautious and be serious before going to say, before going to speak, and please don't spread rumor, don't spread misinformation. The first statement that I have uttered during this video, an infodemic, I'm just again saying, an infodemic of misinformation and an infodemic of rumors is spreading very quickly, rather than the spreading of current coronavirus. More quickly spread this misinformation and rumors than the current outbreak of this coronavirus. So and it will create, that I have said time to time, and also I have said in my previous video, stigma, panic, desperate, puzzle. This will create within the people. So we will be very serious, and this is my request to all of my countrymen, to all of serious people, those who are saying, those who are uttering, those who are speaking through social media or through different channels. Even there are some misinformation observing in some table talk, in some talk show, and they are saying, I don't understand, how can they say, how will they say that this coronavirus will not move through air? How can they say the hot year, or in Bangladesh, since we have a climate change within this time, and temperature is rising day by day, so coronavirus will not be spreaded within this subcontinent. So this is rumor, this is gossip, and so far we have heard that it's a new coronavirus, and it has a lot of strains. There are some genetic mutation already. It has changed its genetic structure through mutation, time to time, and it is adopting itself. It has a adaptive capacity with the climate change. So it will require a lot of time to have a final statement, to have a final features, final characters uh, to find out. So number today, I think I'm trying to make you understand and make me understand, me also, to be aware about the accurate information, and not to be panicked, not to be puzzled, not to be desperate. So, last statement, last request from myself is be careful, be serious, make a self quarantine, or room quarantine, or home quarantine without emergency, without having any emergency need. Don't move, don't go outside from your room, don't go outside from your home, stay home and stay safe. So please don't misunderstand about this video, and don't misinterpret this. Please try to understand the theme of this video, or my statement, or my speaking. So number today, I think you are very serious, you are very careful, you are more curious to know the real fact, and you are not a believer of misinformation and rumors. So number today, more when we or I meet again, and